Hello, I'm Jennifer Moisey, and I'm the Global Medical Franchise Lead of Bacterial Pipeline Vaccines at Pfizer. Clostridium difficile, or C. difficile, is a bacterium or germ that can cause a serious and potentially life-threatening infection associated with symptoms from diarrhea to severe intestinal inflammation. Despite recent progress in intervention, C. difficile infection afflicts hundreds of thousands of people across the U.S. and Europe and remains a widespread and potentially fatal disease that can be debilitating. Pfizer, along with a group of experts representing a cross-section of healthcare professionals and patient organizations impacted by this public health threat, launched a C. difficile awareness initiative to raise awareness of the potential risks for and impact of the infection. They also seek to encourage collaboration across organizations to address and help combat this serious and sometimes deadly disease. Last week, we discussed caring for C. difficile patients up close and personal, and today we'll talk about some of the more vulnerable populations when it comes to this disease. I'm here with C. difficile Awareness Initiative members James Appleby, Chief Executive Officer of the Gerontological Society of America, and Artie Shelton, Director of the Vietnam Veterans of America's Veteran Health Council. Both guests work with high-risk populations and are familiar with the risks of C. difficile. James, Artie, tell us a bit about your experience and what you do.
Hello, I'm James Appleby, CEO of the Gerontological Society of America, or GSA. The GSA comprises the experts on aging who focus on advancing our understanding of the aging process and improving the health and well-being of people as they age. GSA members come from all scientific disciplines, and they play one of three roles. They're either conducting research with and about older adults, they're providing clinical care to adults as they age, or they're serving as educators for the next generation of researchers and care providers. Many GSA members do research on infectious diseases, on health promotion, and on disease prevention, all of which directly relates to this awareness initiative. The GSA team is working on many major projects to improve the lives of older adults, including an initiative that might be of particular interest to listeners titled Reframing Aging. This long-term Reframing Aging project is helping the general public have a better understanding of aging and how we can collectively advance solutions to the challenges we face as the U.S. population ages. Artie?
Well, thank you very much, James. I'm Artie, Dr. Artie Shelton, Director of the Veterans Health Council of Vietnam Veterans of America. And part of that organization, the Veterans Health Council program, seeks to improve the veterans' health care and promote greater awareness that certain illnesses, diseases, cancers, and disorders may have been associated with their military service. In addition, we want to inform veterans and their families and caregivers that VA benefits are available to them for any medical issues that they may experience while having served in the military. And finally, the Veterans Health Council is working on informational and educational materials on veterans health issues that we would like to present to medical schools, nursing schools, and other educational organizations. But currently, I'm concerned about the public health threat that C. difficile will have on our aging veteran population and how best to educate our veterans about this potential serious infection.
Great. Well, thank you both so much for being here. I want to ask a few questions about your experiences working with populations that have a high risk for getting C. difficile infections. First to James. What kind of risk do those who are aging have of getting a C. difficile infection?
Many aren't aware that C. difficile infection, or CDI, disproportionately affects older adults, and it really represents a serious health burden as adults age. In fact, nearly two-thirds occur in individuals over age 65. And sadly, 1 out of 11 U.S. adults age 65 and older who experience health care associated C. difficile infection will die within 1 month of diagnosis. So it's important to take precautions, and it's important that we find ways to educate ourselves as we age so that we can live healthier lives. Antibiotic use is the recognized primary risk factor for developing CDI, and people should take special note of that. Other risk factors include advanced age, recent hospitalizations, a weakened immune system, which can often be due to the aging process or other health conditions that older adults may be experiencing. And finally, a previous C. difficile infection or a known exposure to the bacteria. There's a lot to learn about C. difficile, and I'd encourage listeners to check out the CDC website, chock full of wonderful information. That's at cdc.gov/cdiff.
Thanks, James. As we care for all who are aging, including ourselves, it's important that we continue to educate our aging community about the risks of infection and measures that can help prevent the spread of C. difficile. Artie, in your experience, how do veterans fit into this picture of high-risk populations?
Well, that's a great question. To start, we have more than 19 million veterans in the United States. 47% of these veterans are 65 years or older. This is a growing aging population of people who are at risk and will need to be educated about the dangers of C. difficile. Our veterans, especially those who served in Vietnam and was exposed to the herbicide known as Agent Orange, have a higher risk of contracting many diseases. Other veteran comorbidities that our veterans may experience include type 2 diabetes, heart disease, hypertension, cancer, and immune system dysfunction. These health issues and comorbidities increase the risk of our veterans, as James mentioned, in being hospitalized. And by being hospitalized, expose them to possible antibiotic treatments, which may increase the risk of developing C. difficile infections.
Thanks, James and Artie, for educating us on high-risk populations and risk factors for C. difficile infection. Please join us next week to hear members of the C. difficile Awareness Initiative discuss the work they're doing with Pfizer to raise awareness of this disease. Tune in on any podcast streaming app to hear more.